Docs, scientists ask government to lift Dengvaxia ban. A group of doctors, scientists and health professionals on Thursday urged the government to lift the ban on the controversial Dengvaxia vaccine and allow its limited private use. The statement by the Doctors for Truth and Public Welfare came a day after presidential spokesperson Salvador Aquino said the gov't administration was open to resuming the use of the vaccine amid an overwhelming number of dengue cases and more than 500 deaths due to the mosquito-borne virus. The Philippines has the highest incidence and death rate from dengue in this part of the world. Yet it is the only country in the world that has banned it, said Rising Padilla, the convener. The group is led by former Health Secretary Esperanza Cabral and includes physicians, scientists, educators, former secretaries of health, and past and present heads of various professional medical associations and non-governmental organizations. The vaccine need not be included in the expanded program of immunization, EPI, of the government, so that left square bracket the right square bracket government need not spend for it, but at least make it available to physicians to offer for the millions of patients who can benefit from it, Padilla said. Aborted program. The vaccine was banned in late 2017 after its manufacturer, the French pharmaceutical giant Sanofi Pasteur, disclosed that Dengvaxia could cause severe dengue in patients with no prior exposure to the virus. By that time, more than 800,000 public school children had already been inoculated with Dengvaxia through the P3.5 billion anti-dengue vaccination program of the Department of Health, DOH. The aborted mass vaccination triggered congressional inquiries and lawsuits, including draft charges against former President Benito Aquino III, former Health Secretary Janet Guerin and former Budget Secretary Florencio Abbott, among other people. The Public Attorney's Office, led by its chief, Cressida Acosta, also filed homicide complaints against health officials for the deaths of dozens of children allegedly caused by Dengvaxia. The DOH said no death has been confirmed to have been directly caused by the vaccine. Why don't we try it? Aquino on Thursday indicated there might be grounds to allow the use of Dengvaxia for people who were already exposed to dengue, but said scientists must agree on that. If we know that Dengvaxia could be used for seropositive patients, then why don't we try it? We will just consider it. We have to make a study. As I said earlier, it requires a serious study before we can use it, he told reporters. Why not use Dengvaxia for those who already had dengue before? Because it will surely work there, he said. Mine is only a suggestion. But didn't they say that the dengue cases are worsening? We need a vaccine for that. The said it supported the decision by the World Health Organization, WHO, to include Dengvaxia in the July 2019 Essential Medicines List and list of essential diagnostics. Medicines on the WHO list are those that people should have access to at all times and in sufficient amounts, it said. No basis for fear. Speaking to reporters after a mass marking the 10th death anniversary of his mother, Corazon Aquino, on Thursday, former President Aquino said he still has not read or heard of any proof supporting the fears associated with Dengvaxia. So if there really is nothing wrong with this medicine, and that it even helps, why don't we use it to ease the anxiety of the more than 100,000 of our people afflicted by dengue? He said. The DOH reported more than 130,000 dengue cases nationwide, with 561 deaths, as of July 13, or almost double than last year. Close to 30,000 cases were children ages 5 to 9. Western Visayas had a worse situation with 18,943 cases and 95 deaths. Aquino said he doubted whether the people who claimed that the vaccine purchased by his administration actually killed instead of saved people would admit their mistake amid a spike in the number of dengue cases. Let us just say that certain people have another motivation, which is to stir fear not only in regard to Dengvaxia but other vaccines as well. The means to protect public health have been denied to our people because of politics and ill motives, he said. With a report from NIKKO, DIZON, contributor. Thank you for watching. Please subscribe.